We all go for those annual health checkups thinking we're doing the absolute best thing for ourselves. I mean, they're supposed to be purely beneficial, right? But what if I told you that some of the most common routine tests, especially for seniors, might actually come with some serious hidden risks?
It's a pretty provocative question, and one we don't often ask. But the science we're digging into today suggests that for some of these tests, the answer is a surprising yes. We're about to find out why more testing doesn't always equal better health.
37%. Just let that number sink in for a second. That's how many medical tests done on seniors, according to new studies, can set off a whole chain of reaction of problems. We're talking unnecessary treatments, complications, even lifelong side effects. So the real question is, which tests are we talking about? So in this explainer, we're going to uncover the science behind 5 of these seemingly safe tests. Based on what the latest research tells us, we're going to count down the top offenders, starting with number 5.
All right, let's jump right in with number 5 on our list. Now, this is a scan that so many people get without even a second thought, but it can kick off a whole cycle of fear and over-medication that often does way more harm than good.
So the first 2 tests on our countdown, they fall into a very specific category. They're really, really good at finding things that aren't necessarily dangerous. And this can lead to a ton of anxiety and what we call overdiagnosis.
And coming in at number 5 is the bone density scan, also known as a DEXA scan. This is just a perfect example of a test that can create fear. The promise is so simple. Hey, let's find weak bones to stop fractures before they happen. But the peril? It basically medicalizes the completely natural process of aging, and it turns normal, age-related bone loss into a disease that seems to demand some kind of aggressive treatment.
And this is what happens next, right? A scan shows maybe just mild bone loss, and it often leads directly to a prescription for these drugs, bisphosphonates. But look at the potential side effects. We're talking about jawbone death and serious digestive problems. The real kicker is that studies show these drugs barely reduce fracture risk for those mild cases, but the side effects? They're very real.
And this has a real human cost. Just listen to the story of Rose. She's a 76-year-old piano teacher. No falls, no pain, feeling great. A routine scan leads to a drug prescription, and the result? Severe pain that actually forced her to stop playing the piano. The so-called cure was way worse than a condition that wasn't even causing her any problems to begin with.
So if that sounds bad, well, the stakes get even higher with our next test. We're actually moving from jaw pain to the risk of something as serious as unnecessary brain surgery.
Okay, at number 4, we have the brain MRI for mild memory complaints. When an older person starts worrying about being a little forgetful, getting an MRI seems like a really logical step. But the source material on this is crystal clear. These scans are masters at finding what they call age-appropriate changes, things like a little bit of brain shrinkage or some white matter spots that then get misinterpreted as signs of a really serious disease.
And the data here is just staggering. A study in Neurology Today looked at these MRIs. Get this. 86% found some kind of abnormality. But look at what actually happened. Only a tiny 3%, pointed to something that could actually be treated. And yet, a shocking 11% of patients were sent for invasive follow-ups, like spinal taps, all based on what were probably just harmless, age-related findings.
Just think about George for a minute. He's 74, and he got an MRI just because he was misplacing his keys more often. The scan showed normal, age-related changes, but the way the report was written sent him into a total spiral of fear. He gave up driving. He stopped going to his social clubs. His whole life changed, all because a test turned a normal part of aging into a terrifying diagnosis. The psychological damage was just immense.
All right, now we're going to shift gears a little bit. We're moving from tests that mainly cause fear and anxiety to ones that can directly set off a cascade of physically dangerous and invasive procedures.
At number 3 is the cardiac stress test. And this is where we can really see that domino effect in action. It's often ordered for really vague symptoms like just feeling tired. But here's the thing, for adults over 70, it has a false positive rate as high as 40%.
That means it frequently signals a serious heart problem where none actually exists, often just because normal changes in an aging heart can look like signs of disease on a test. And this is that dangerous domino effect. It starts with something so simple, like feeling fatigued. Then the stress test comes back with a false positive. That triggers an invasive angiogram. And during that procedure, maybe a minor, harmless blockage is found. Then an unnecessary stent gets put in, and the patient can end up with a serious complication like kidney injury from the whole thing. A simple feeling of tiredness can spiral into a major medical event.
Okay, get ready for number 2. This is a procedure that so many of us think of as just a non-negotiable part of healthy aging. But the data, especially for people over 75, tells a very, very different story.
It's the colonoscopy. Now, for people over 75 who don't have any symptoms, the promise of finding polyps is often completely overshadowed by the peril. The prep itself can cause serious dehydration and dizziness. The sedation carries real risks for an older brain. And the procedure itself, while generally safe, has a small but real risk of tearing the bowel.
And the risk-to-benefit ratio here is just stark. A major study found that for every 1,000 colonoscopies in this age group, only 2 lives are actually saved. Meanwhile, more than 20 people will suffer a serious complication. Let that sink in. That's 10 people harmed for every single person helped.
And now, we've made it to number 1. The checkup that's been identified as the most overused and potentially the most dangerous, all done in the name of prevention.
Number 1 is the annual full-body CT scan. You see these marketed sometimes in those executive health packages. Its biggest danger lies in the just sheer amount of radiation. A single scan exposes you to the same amount of radiation as about 500 chest x-rays. 500.
And that massive dose of radiation has a terrifying potential consequence. Modeling studies are now suggesting that the explosion in CT scans may be responsible for up to 5% of all cancers in the United States. To put that into perspective for you, that puts these scans on par with alcohol as a cancer risk. A test meant to find cancer might actually be causing it.
Okay, so after all of that, what are we supposed to do? Well, the goal here isn't to be afraid of medicine. Not at all. It's to be smarter about it. It's really about shifting our focus from just routine testing to a more proactive and personalized way of looking at our health.
So, what's a better path forward? Well, it really starts with listening to your body instead of just testing for problems you don't actually have. Focus on the things that truly prevent disease, building strength, working on balance, and good nutrition. For screening, you can consider safer alternatives, like a FIT test instead of a routine colonoscopy. And maybe most importantly, always ask your doctor this critical question. If this test finds something, what happens next? Understanding that potential cascade of events is absolutely key.
So we'll leave you with this final thought. The next time a routine test is suggested, just pause for a second and ask yourself this question. Is this test truly for my physical health, based on my symptoms and my actual risk factors? Or is it really just a quiet fear? Knowing the difference, well, that's the first step toward becoming a truly empowered patient.